And this morning I would like to speak to us about an interesting topic, about the role of ultrasound in reducing maternal mortality rate. First of all, let me start by defining what this is, as defined by World Health Organization. This is a measure of disease burden, which we use to look at the number of deaths arising from pregnancy complication during pregnancy period and during childbirth amongst 1,000 expectant women. So why should we do ultrasound? To help reduce this number. We just want to make sure that when you are carrying your pregnant, that it's normal. It's a normal pregnancy and there's no complications during this period, and even during that day when you're having during that day when you are delivering. So we look at we do an ultrasound just to make sure that you are carrying a normal baby, that there's no intrauterine growth restriction, that the growth of the baby is in tandem with the gestation age. We look at the uterus to make sure there is no fibroids in the uterus, to make sure that even if the fibroids are there, we look at the numbers, make sure they're not so big to even bring an issue or bring a problem during childbirth. We look at the position of the fibroids, make sure they're not low lying. We also want to look at the position of the placenta. Sometimes when you're pregnant, the placenta will implant down there at the internal opening, the internal opening of the cervix, the internal cervical os, and cause something in medicine we call placenta previa or a low-lying placenta. This could cause bleeding during pregnancy or even during childbirth. Bleeding that could cause death. Once we know all these things, we'll communicate the information to the team of the physician and clinicians who are attending to you at your clinic. We also want to make sure that we want to rule out multiple gestation. We want to make sure that if you have twins, if you have triplets, if you have quadruplets, we communicate this information so that prior arrangement, and even as you attend the clinic, they know how they can attend, how they do a prior planning, even in terms of delivery, in terms of just managing that pregnancy period. We also want to look at the umbilical cord, make sure that the umbilical cord is not looped around the neck of the baby. We want to look at the insertion of the umbilical cord to the placenta. We want to make sure that this umbilical cord is not inserting deeply into the muscles of the uterus. This can also cause bleeding. It can cause bleeding that can cause a lot of it can cause a mother to lose out of blood and even cause death. We also want to look at the amniotic fluid, make sure the amniotic fluid volume is okay, is not increased and is not reduced. We also want to look at the cervical region, the cervix of the mother. Make sure there is no masses at the cervix. Make sure the cervical region is clear. If there is anything there, again, we want to communicate this information to the team of clinicians who are attending to you at your clinic. So we also want to look at the presentation of this baby. Where is the presentation? How is the baby presenting? How is the position of the baby? If we get that the baby position or presentation is not it's abnormal, again, we will want to share this information with the team of with your clinicians, with the physician who are attending to you at your clinic. So once you go to the clinic and you are given these requests, or you are told to go and do an ultrasound scan, kindly go and do it. I know the ladies or the mothers who have refused or declined to do this because they don't know the reason why they should do it, but at least now you know the reason. The many years we have practiced, every time I see a mother in a radiology department, my desire has always been, how do I add information to whatever we have, so that at least we can have a normal pregnancy period, and we can have a normal child after 9 months. So that has always been our desire, and that is the reason why we do this screening. So kindly, once you go and you are told to do a scan, kindly don't decline, go and do it, because it's of importance. It's of importance because we don't want to lose any mother because of some of these complications, which, if they are diagnosed earlier, a solution can be found, a solution can be administered, so that at least we don't lose any mother. We don't lose any mother because of complications arising from pregnancy. That has been our desire, and even as this has been one of the Millennial Development Goals for World Health Organization to reduce the maternal mortality rate. Our desire is, what can we do to contribute? What can we do to contribute to this goal? What can we do to contribute to this desire of World Health Organization to reduce these numbers? So don't decline to do this. Go have the screening done, because I'm sure and I'm hopeful that if there's anything is going to be detected, and at least we'll have a normal pregnancy period, and we will celebrate even after 9 months once that baby is born. So thank you very much for tuning in. Thank you very much for always listening to the information that we share. And once you get it, kindly share it outside there, because I know someone else, somewhere